Hey nurses, my name is Lauren, and we're going to talk about the options you have to advance in your career. Do you feel stuck in your job? Do you want to learn more, do more, be more? Maybe that's not the question you're asking yourself, but maybe you know that you don't want to work as a bedside nurse anymore, and that is okay. As a nurse, you have a multitude of options available to you. I had these same thoughts and spent a lot of time and research and spreadsheets trying to figure out where I wanted to go next. At the end of this, you should have a better idea of the roles available to you, what you can do in these roles, and what you need to do to get there. So, what are those options? An APRN is an advanced practice registered nurse, and that term covers an umbrella of career paths and can also be very vague. It is defined as any form of nursing intervention that can influence healthcare outcomes for individuals or populations. This can include direct care of individual patients, management of care for individuals and populations, administration of nursing and healthcare organizations, and also the development and implementation of health policy. Helpful, right? Not really, so let's break it down. Basically, APRNs work to change the health outcomes of people or a group of people. This can be through one-to-one interaction with one specific patient. It can be covering the well-being of a larger group of people. It can be a role where you oversee nurses or an organization, or you can develop policies to create change within healthcare. Specifically, there are many roles you can be in as an APRN. The four main roles are nurse practitioner, certified nurse midwife, certified registered nurse anesthetist, and clinical nurse specialist. The largest group of APRNs are nurse practitioners, so we'll start with them. Nurse practitioners typically work independently in a range of patient populations and provide direct patient care. They are responsible and accountable for health education, health promotion, disease prevention, counseling, and diagnosis and management of acute and chronic diseases. Through nurse practitioners, initial, ongoing, and comprehensive care can be provided to families, pediatrics, geriatrics, women's health, and internal medicine. This can be either in primary care or in acute care. Clinical nurse specialists also provide advanced care to specific populations and across the continuum of care. This role includes the patient, the nurse, nursing practice, and the healthcare organization and system. As a clinical nurse specialist, you would be responsible for a diagnosis and treatment of health problems, disease management, health promotion, and prevention of illness and risk behaviors. This can be with individuals, families, groups, and communities. These two roles sound pretty similar, right? The difference between the two is that nurse practitioners conduct assessments and diagnostic testing, while clinical nurse specialists provide teaching and consultation. Nurse practitioners work more on an individual patient basis, while clinical nurse specialists work to see the bigger picture. The next two roles are more specific. Certified registered nurse anesthetists provide anesthesia and anesthesia-related care. This role is typically found in surgical suites and can range across levels of acuity and different lifespans. A certified nurse midwife provides care to women across their lifespan. This can include gynecological care, family planning, preconception care, prenatal and postnatal care, childbirth, and care of the newborn. They can also provide care to the male partner of their female clients in terms of sexually transmitted diseases and reproductive health. Certified nurse midwives can work in the patient's home, in the hospital, private offices, birth centers, or ambulatory care centers or clinics. Beyond these four major roles, APRNs can also include clinical nurse leaders, nurse administrators, public health nurses, forensic nurses, nurse educators, nurse informaticists, and many other positions. Clinical nurse leaders, not to be confused with clinical nurse specialists, are newer to the nursing workforce. They provide direct clinical leadership at the point of care and work to ensure a safe patient environment. Nurse administrators can be nurse managers, nurse executives, directors, supervisors, etc. These nurses are responsible for leading a successful work environment. Public health nurses work within the community to provide a healthy environment, promote healthy lifestyles, provide outreach, monitor health services, and prevent and control epidemics. Forensic nurses are advanced practice nurses who specialize in patients experiencing acute and long-term health problems related to victimization or violence, and/or have unmet needs related to victimization or violence. Nurse educators can work in the academic or clinical setting to prepare the nursing workforce to provide high-quality care to changing populations. Nurse informaticists work to guide practice in healthcare settings to meet meaningful use criteria and contribute to safe patient care. With each of these options, you need higher education. All require a registered nurse license and a bachelor's degree. Most require a master's degree. Some require additional licensure, and some require certification. Beyond that, you can also obtain your doctorate and your PhD. I have created this handy chart to show you the minimum amount of education you need for each role. You may also need special training or experience that would make you more qualified for the job. Also, in each role, there are continuing education options available to help you advance further. You can never have too much education or knowledge. Know your role, but also know your role. First, you must know what your job is going to entail. What is in your job description? Then you have to know what you're allowed to do within your role. Specifically, nurse practitioners, clinical nurse specialists, certified nurse anesthetists, and certified nurse midwives are regulated by their education, licensure, and accreditation. Each of these paths comes with their own scopes of practice. The scope of practice is what you are legally allowed to do to what patients, with what supervision, and when. Even though your education may have taught you everything you need to know, you may not be allowed to actually do it all, and you may need guidance from a physician. Within scope of practice, there are national rules and regulations, and also state rules and regulations specific to where you live. Many APRNs have been working towards clarifying and lifting barriers to practice. Many states have adopted the consensus model, which provides uniformity in the APRN roles, licensure, accreditation, certification, and education. However, many states have not adopted this model yet, and APRNs need to know the rules if they move from state to state. This represents an obstacle to license portability and can prevent access to APRN professionals. The remaining APRN roles have specific responsibilities, and I think it would be difficult to work outside of those roles.